Morning guys. If you're watching this video, you've probably got a biopsy coming up. I have a previous video that I did 2 years ago on a transrectal biopsy, and I've just had a transperineal biopsy, so about 2 years after the first one. And the purpose of this video is to tell you what the experience was all about and what happened. First of all, the reasons for the second biopsy. My PSA has been sitting around 4 to 5, and in the last 6 months it started to increase a little bit faster than previously, and now it's around 6. So my caregiver decided that a transperineal biopsy was indicated. A transperineal biopsy is done under a general anaesthetic, and there's lots of YouTube videos on the procedure. It involves about 30 odd needles being inserted in the perineum, which is between the anus and the scrotum. Sounds terrible. I must admit I wasn't looking forward to it too much. So here's what happened. A day or two before the procedure, I had a meeting with the surgeon and with the anaesthetist, and they took the usual stats, blood pressure, previous history, etc., etc. That was just a meeting. I was asked to turn up to the hospital 7 o'clock in the morning. The procedure was scheduled for 10. I sat around in a waiting room doing nothing for 3 hours. Fortunately, I took a book. So my first advice is to take a book with you, because you will spend some time sitting around. I was then taken into the pre-theatre room and dressed in the normal garb, a pair of elastic stockings, no other preparation, no injections, no medication, nothing else, just again a few more questions, a short meeting with the anaesthetist and a short meeting with the surgeon, both of which were reasonably pleasant, and plenty of opportunity to ask questions. I'd done a lot of research, and I thought that I knew the procedure pretty well. I did ask the surgeon about any side effects. He didn't tell me about one side effect, which I'll elaborate on shortly. I was then walked into the theatre, lay down on the table, given an injection, and that was lights out. That was at 10 o'clock in the morning, and my first conscious reaction later was 12 o'clock, when a pretty young nurse asked if I was awake and if I would like something to drink. At that point I was in no pain, and I felt I felt woozy from the anaesthetic, but no other effects. That's when the experience actually started. I hasten to state that I had no after effects from the procedure itself. So there was no pain from the injection site, from the needle site, and no pain from the procedure, from the samples taken from the prostate. The two effects I did have were nausea from the anaesthetic, and I couldn't pee. And that was the effect that I had predicted, and I did ask the surgeon, and he said, oh, it doesn't happen very often. Apparently it does. So I spent the next 4 hours trying to pee and drinking and trying to pee and vomiting because of the nausea from the anaesthetic. And I've had anaesthetics before and never had this effect. So that was out of the blue. Probably the anaesthetist used a different anaesthetic, but it wasn't all that pleasant. So they decided at 7 o'clock that night that they would admit me overnight, because I still hadn't peed, and they won't send you home in that condition. So at about 7 o'clock 7:30 that night, 8 o'clock, they decided that because I could not pee, and that reminds me, I need to drink something. gone through litres and litres in the last 2 days. The procedure was 2 days ago. And so I was taken up to a ward, and of course my fear was a catheter. And no doubt you guys who have never experienced a catheter have been secretly worrying about it for most of your life, if you're like me. I met a very nice house surgeon in the ward, and the first thing he said was, well, your bladder is up to about 700 cc's, because they measured it every hour or so. And he said the chances of being able to pee when it gets to that size are fairly remote. I think we'll go for a catheter. And I remember saying to him, well, I never ever thought I would hear myself say this, but let's do it. Because by that stage the full bladder was fairly uncomfortable. It wasn't terribly painful, it was just uncomfortable. So he said, I'll go away and get the trolley, and so I sat in the bed inwardly shaking in fear for the next 2 or 3 minutes until he returned with a young student lady doctor who asked if she could help, and I had no problems with that. I need to say right now that the catheter insertion was no deal at all, no problem at all. What he had was a syringe of KY gel and lidocaine, I presume, and so he injected that into the end of the penis, and that was totally painless. It flowed up through the urethra into the bladder. It took about 1 or 2 seconds for that to happen. Again, that was totally painless, and it instantly anaesthetised the entire urethra. He then opened the catheter in a sterile manner, which was about that long, plastic tube with a round end on it. It was a Foley catheter, so a Foley catheter has a little inflatable balloon at the tip, which is inflated with saline to stop it coming out. He inserted the catheter. That took 5 to 10 seconds. I scarcely felt it. It wasn't unpleasant, and it was certainly not painful. The young lady inflated the cuff on the distal end. He attached the other end to my leg with a bit of sticking plaster, put the bag on the end, job's done, and instantly my bladder emptied and the pain disappeared. The discomfort disappeared. I got quite a bit of sleep that night. The only thing that kept me awake was the guy next door snoring very, very, very loudly. I was nauseous during the night, and next morning they came and saw me and said, you're off home and you'll need to wear the catheter for another 5 or 6 days. I wasn't too happy about that, but I have to say, and I've got the catheter on now, I have to say that by the time I got home and repositioned the sticking plaster, because they had the sticking plaster too far up the leg, and every time I moved my right leg it pulled on the catheter, which was damned unpleasant, uncomfortable. So I got that repositioned with a bit of a loop, a bit of slack in it, and so it's now, I've now had the catheter for 2 days, I'm back at work. I'm functioning at about 80%, I suppose. The anaesthetic took a while to wear off. I did come to work yesterday briefly, and then went home straight afterwards, because once I got here I found that I couldn't concentrate, and things were a little fuzzy, but that was the anaesthetic. So it's now 2 days since the procedure. I have virtually no pain at all from the prostate or from the needle site. I'm not taking anything for it. I didn't take any paracetamols or any other medication apart from the day of the procedure, and that was because the nurses insisted, and I didn't ask for it. Okay, sorry about that. I had a phone call. I was talking about the side effects. So there were 3 side effects. The the most severe was the nausea, the vomiting, and that was the anaesthetic. It took until next day for that to subside. Not being able to pee and having to have a catheter was a pain in the a pain in the butt. But apparently that's relatively common with a transperineal biopsy, because the prostate obviously is going to object to having 30 odd needles poked into it, and so it's going to become inflamed, swollen, and of course it squeezes the urethra, which goes down through the middle of the prostate, and you can't pee. So that necessitates the catheter, but as I said before, the catheter is no big deal. I was majorly concerned about the catheter, and it has been the least of my problems, and it still is. It's a bit of a nuisance, having a shower and having to empty the damn thing, and having a lump of plaster across your leg, but other than that I can see how people survive with catheters for years on end. And I'm drinking a lot. What was the third side effect? Pain from the prostate, virtually nil, and still right now. I mean, I can feel it. I can feel there's a little bit of pain when I sit down, but it is on the scale of 1 to 10, it's about 1 or less. Slightly sore throat, slightly husky throat because they had a cuff in there, obviously. And slightly woozy from the anaesthetic. So the biopsy itself is no big deal. A reasonable amount of blood in the urine yesterday, and virtually none today. So that the urine was pink yesterday, and it's normal today. So that's it, guys. I haven't had the result yet. I get the result of the biopsy in 2 weeks, and I'll shoot another video on that, and what I decide to do after that. Would I recommend a transperineal biopsy? I would say that if your surgeon says that it is indicated, and it gives a much better result than the rectal one. In other words, they can take more samples and they can sample the whole prostate. The problem with the transrectal biopsy is that they have difficulty sampling the whole prostate. So it does give a much better analysis of what's going on. The human mind forgets things pretty quickly. I mean, I can remember saying to my wife, who fortunately was there, I can remember saying to her on Monday night, today is Thursday, and Monday night after this procedure, I can remember saying to her, I haven't felt so rotten for a long time, because I had gastric reflux because I forgot to take my medication with me. I had the nausea, and I was unable to pee, and I was stuck in hospital, and I expected to be home. But you forget that, and you know, it was 3 days ago, and now it's fortunately the human mind remembers the good times, and it discards the bad times. And that's why I'm doing the video today, because in another week I will have forgotten the bad episodes and won't be able to remember them. So words of advice, if you do decide to do this biopsy, is have your wife or partner or whatever to support you, because it makes a big difference. Take your medication with you. Don't expect to be home that day. So I left my medication at home, and I got bad gastric reflux because I didn't have my medication, and the bureaucracy in the hospital of giving you new medications, there's a big long time delay, and it was at least 2 hours before I got that medication. Take some spare clothes with you, and be prepared that you might have to stay the night. Take a support person with you. They do say that in the paperwork. My sister fortunately lives close to me, and close to us, my wife and I, and so she took me to the hospital at 7 o'clock in the morning and waited for 3 hours with me in the waiting room, and she's been a great help in the last few days, and my wife was there during and after the procedure, and having that other person makes a big difference, and so I was very, very thankful for their presence. So that's it, guys. Please send me any questions or comments, and I'll certainly do my best to reply to them in a timely fashion. I will reply to everybody that sends me a comment, and I'll post another video in a week or 3 when I have the results. Good luck.